Assalamu alaikum. My name is Dubai and my roll number is BP1650241 and I am from 5th Prof. The topic of discussion is local anesthetic and the drug which I am going to cover is lidocaine. Moving towards the introduction of this drug is also known as lidocaine and xylocaine, and it belongs to the aminomide type of local anesthetic. The indication or use in which this drug is used is to reduce the pain or discomfort, which is basically caused by any kind of invasive medical procedure, such as if person is suffering, if person is having surgery or needle punctures, or if any kind of insertion in the person's body, that is insertion of a catheter or breathing tube. So as a result of all these conditions, if any kind of pain or discomfort originates in the patient body, so lidocaine or especially local anesthetic can be given. The mechanism of action or the principal domain of this drug is to block the sodium channels, and this drug function as this drug block the influx of the sodium inside the cell, but this blockage is reversible, and as a result of this blockade the action potential propagation blocks that result in the numbness of the area of your body. The side effects that result in the administration of this drug is the hypotension, edema, there is redness and inflammation at the site of injection. As a result of injection, the small red or purple spots on skin may originate skin irritation, constipation, and vomiting. The rational use of this drug is that because it is used in surgical procedures, it may be used in acute myocardial infarction, digoxin poisoning, cardioversion, cardiac catheterization, and ventricular arrhythmias. Specifically, it is also used in the ventricular tachycardia and fibrillation. Lidocaine belongs to the 1B antiarrhythmic drug class, and it blocks the cardiac sodium channels. It shortens the action potential, and it is used in the intravenous condition for arrhythmias. Moving towards the irrational use of this drug, as this drug has abuse potential side effects, and it can cause euphoria. If a person is taking for a long time, it can cause severe side effect. If person is taking it as a self medication, or overuse or overdosing, or if doctor prescribed it at a wrong level, so this drug has serious side effects, because if substantial amount of this drug is ingested and it is absorbed into the bloodstream, so it can affect vital organs, primarily the brain and heart. And if lidocaine is ingested, the numbness of the mouth and throat can also occur, which lead towards the trouble swallowing and even choking of the tract. So all these are the irrational use of the drug. Now moving towards the dosage forms that are available, that are available are the syrup, ointment, and cream. It can be available in the form of patch, gel, injectable, spray, and soap. The individual use of all these forms are related to their use. For example, if viscous lidocaine syrup is used by the patient, so it can be used in the relief of sore throat. If we discuss about cream and ointment, it can be used for burning and itching of the skin. Lidocaine patch can be used to treat the symptoms of nerve pain. Gel can be used as anesthetic, lubricant to insert instruments in the body. Lidocaine injectable can be used in the surgical procedure, for example, in operations and medical procedures. Spray can be used to numb the mouth, throat, nose before any surgical procedure, and soap can be applied during and after a session to provide a comfortable and soothing sensation. Now, the toxicity, if this drug is overdosed or wrong prescribed, so it can cause a central nervous system toxicity, and central nervous system toxicity can be seen at plasma lidocaine level is low as 1 to 5 microgram per ml. Levels in this range commonly lead to clinical signs including tinnitus, dyspepsia, lightheadedness, nausea, and double vision, that is also known as diplopia. Contraindications, this drug is contraindicated in all the situations that is added below. For example, if a person has a G6PD deficiency, It should be contraindicated. Low amount of potassium in the blood, methemoglobinemia, which is a blood disorder, and skeletal muscle disorder, and the partial heart block, White syndrome, Sware heart block, and Adams-Stokes syndrome. So in all these conditions, the local anesthetic lidocaine drug should be contraindicated. Now, from the point of view of pharma economic, these are the highest price brands and the lowest price brands. Xylocaine having a price of 810, and Cane lidocaine is 767 rupees. Lidoject having amount of 600, and Lignocaine, which is the lowest price brand, is 17 rupees, and it is manufactured by the Lahore Chemical Pharmaceutical Works Private Limited. And Logel having cost of 15 rupees. Elite Pharma is the manufacturer of this drug. Polycane having rupees of 10. It is manufactured by Shifa Laboratories Private Limited. So these are the pharma economic background of this drug. Now moving towards the case study that is related to this drug, a patient with 84-year-old age, he is white man who is overweight about 90 kgs, and he has a long-term diabetic condition, and just due to this diabetic condition, he might be suffering from pedal plus right foot and plus left foot. He has a history of wearing no socks and gardening 2 days ago with new tight shoes. He has now presented with 2 large dorsal lesions, one necrotic and lengthwise 2, and a smaller lesion blistered and filled with fluid. So because of no wearing of socks, and he is doing gardening and wearing a new tight shoes, and because of this pressure on his foot, he has 2 large dorsal lesions, a necrotic and lengthwise, and smaller lesion which is fluid filled. In addition, he has onychomycosis on 5 of his 10 nails, mainly affecting his hallux digits. In clinical laboratory show levels, which all these levels shows that he is suffering from diabetes, from severe diabetes. That his OG-TT level is 250 milligram per deciliter, and HbA1c level are 6.5%, which is beyond the limit. The parameters of this patient, for example, urea is 8.48, creatinine is 52.60, total cholesterol is also beyond the limit, HDL is also increased in limit, albumin is increased, sodium, potassium, calcium, means all the clinical laboratory testing shows that he is suffering from chronic diabetes. Moving towards the soap note, the chief complaint is that he has 2 large dorsal lesions, one necrotic and lengthwise 2, and a smaller lesion which is fluid filled. Subjective is that he is male, having the age of 84 years and bearing weight of 90 kgs, and he has long-term diabetic and pedal plus right foot and pedal left plus, and he has a history of wearing no socks and gardening 2 days ago with new tight shoes. Objective is include all the clinical laboratories initials. For example, his fasting glucose level is 6.80 millimole per liter. Random blood glucose is 33.31 millimole per liter. Urea is 8.48. Creatinine level is also increased, which is 53.40 millimole per liter. Triglycerides, HDL, sodium, potassium, magnesium, calcium, OGTT, and HbA1c levels all are increased in limits. So these clinical trials will give us the assessment that person is acute in his diabetes. Now, if we are moving towards the assessment, patient is suffering from long-term diabetes and he is on medication, but due to worsening of problem, he starts feeling pain in foot, and due to tight socks, the condition of lesions is getting worse. So, as already mentioned in the case study, that he has 2 large dorsal lesions, and one small lesion is fluid filled, having blister, and he is in pain. So as far as anti-diabetic drugs are prescribed to patients, some soothing and numbing drugs should also be given so that pain should be minimized and the condition of a person foot is reduced. So we are moving towards a plan. If person is diabetic in condition and he has chronic disease, so for diabetic condition we may suggest that he should take dapagliflozin and metformin, which is named as Zigdo or glyceride metformin or glucovans, with the potency of 10 milligram per 500 milligram and 1.25 milligram per 250 milligram twice daily with the morning and evening meal may be used respectively. Uh, Person has complaint of lesions and pain. So for the lesions and pain, we would suggest that he should take any soothing and numbing drug. The treatment plan includes daily cleaning with diluted betadine solution and the application of 1 meter dose pump, 0.25 milliliter of prescription istro and DST. Patient foot was then inserted into an open to wooden post-operative shoe, so that this condition should be reduced. Patient returned to clinic 1 week later and has experienced very good clinical results and wound healing. Patient reported pain on weight bearing the first day. After 1 week, no pain was felt on the weight bearing. This Astro provides the clinic or proven or trusted first line wound dressing for patients with painful wounds who are also diabetic. So the purpose of suggesting or prescribing this drug to this patient is that because it is useful in the painful wounds for the patients who are also diabetic. The soothing hydrogel containing meadowsweet or oak extract creates a superior wound healing environment, while the lidocaine component imparts sustained pain control of the wound. The references which I'm taking all this material is Kadgen Pharmacology book, Coda Kimball Applied Therapeutics, Drugs Info System, Poison or Gensco Pharma, Medical and Reaction List, Research Kit and Science Direct. And this is all about my presentation. Thank you.